Joining us here on WCCO This Morning to talk about COVID-19. It is a form of coronavirus. Dr. Tim Sielaff, the Chief Medical Officer at Allina Health.
Good morning.
Dr. Sielaff, thanks for coming in. 2 cases in Minnesota confirmed now. First, I wonder if you could just give us the broad overview of that. When we hear 2 cases, I think perhaps it makes people feel like, not much to worry about here. Is the media overreacting on this?
Well, I would suggest that we don't have all the information we need because testing has not been widespread. We really don't understand the full breadth and complexity of the outbreak.
Is that because we don't have enough testing kits out in the wild, if you will?
Yeah, when you think about the number of tests that are going on in South Korea, there are 20,000+ a day. We haven't done 20,000 total. So we really need to ramp up our testing so we can understand the breadth of the infection.
We had a story on just a little while ago about hand washing and the proper way to hand wash. I wonder if we are focusing so much on the actions that people can take. I just wonder how much do we know about whether this is really spreading through people not washing their hands? Or is this mostly people cough and sneeze and you're close to someone and that's how you get sick?
Well, again, I'm not positive we have a complete understanding of what the factors are that will prevent the spread of the disease entirely. So I think it makes perfect sense to wash your hands thoroughly and frequently.
It's always a good idea.
It's always a good idea.
Right.
It's a good idea to cough into a handkerchief or into your sleeve and then wash up after that. And if you're sick, you really do need to stay home. Those are just common sense public health prevention efforts that can be taken by everybody, and so everybody can play their part in preventing the spread of the disease.
But we don't really know if if you look at where the major outbreaks have been, it's on a cruise ship where everybody's close together. You're like, yeah, that makes sense. That's how we know something like the flu or a coronavirus is transmitted.
Right, and coronavirus is transmitted by droplets. And so anything that we can do to mitigate the spread of those droplets, cleaning surfaces, et cetera, can be very helpful.
Well, let's talk about that because we do have a question from one of our viewers, and we're getting questions. You can respond to me on Twitter with your coronavirus or COVID-19 questions, or leave it on our Facebook page. But we have a question from Elizabeth Williams here, who's asking about the spread, and you mentioned this, but she wonders, how long does the virus live in the air and on surfaces?
Well, it's spread by droplets, so it's probably not in the air for very long at all.
It's not hanging out there long, right?
Like measles virus, for instance. But it's on surfaces, and it can be alive, to the extent that viruses are alive on a surface, for several hours.
Okay.
And so if you are touching surfaces that are around people that are spreading droplets, or if you're spreading those droplets yourself, you should really clean those surfaces. Or if you're touching those surfaces, be sure to wash your hands thoroughly after doing so. Don't put food down on those surfaces, etc.
Another one of our viewers asked about public water fountains, if using a public water fountain is a good or a bad idea right now.
Yeah, I don't think there's any evidence about that particular topic, but again, being around areas that are used frequently and extensively and have a risk of droplets could be of concern.
Okay, good. Just to note, we didn't shake hands. We did the old
public health elbow bump.
Just kind of a smart precaution. We're all doing the best we can, right?
Yeah, exactly, and it doesn't cost anything.
Exactly. Okay, keep your questions coming. Hit the WCCO This Morning Facebook page and leave your question in the comments there. We'll get more of your questions answered in the next hour, guys.
Thank you, Jason and Katie. Yes, Dr. Tim Sielaff is here with me now. He's a Chief Medical Officer at Allina Health. Thanks so much, Doctor, for coming in.
My pleasure. Good morning.
Well, we know that there are a lot of questions, and we really want to understand how to be prepared for this virus more. We hear so much about the importance of washing hands. What else should we be doing?
Well, I think it's really important to wash your hands if you're coughing, to cover your cough. If you're feeling unwell, if you're sick, you should really stay home and protect yourself and protect others from exposure.
And we also talked about, maybe avoiding the handshake, just do the elbow bump.
Yeah, the public health elbow bump is a good idea.
Okay, all right. Let's talk about what Allina is doing to make sure that they're protecting its workers? I know we've heard a lot about what the hospital is doing at Abbott, but what about, the clinics? You think about all the clinics and all the people who work there.
Right. It's really important to protect our healthcare providers, because if there is an acceleration in the number of ill people, we need healthcare providers to take care of those folks. What we recommend is that individuals call ahead if they feel as though they're at risk and want to be tested or evaluated. Call ahead to the clinic so the clinic can do some screening questions, number one, and determine if an individual is at risk. And if they are at risk, they can make some preparations at the clinic to isolate the patient, to protect themselves and to protect the other patients in the clinic. Of course, if you have a fever and a cough and exposure and you're getting short of breath or having shortness of breath, that's a more serious set of concerns, and calling and getting triaged maybe to an urgent care or to an emergency department may be the better thing to do under that circumstance.
Well, we've got some questions from our viewers. Let's go to Jana's question first. She wants to know, what are the symptoms and how they differ between the flu and the cold? Because that is a really good question, Jana, because the symptoms are so similar. Mm-hmm. And so how do you know, when you should go in and get tested if it's just a simple cold?
Yeah, so again, the symptoms are very similar. You're absolutely right. The history of an exposure or a potential exposure, either through travel or contact with somebody who has traveled, would be a key issue. And so if you're feeling sick, if you're feeling worse than you normally would feel, and you believe you need to seek medical attention, then calling the clinic and having those triage questions taken will be really helpful in helping differentiate a simple flu and cold from a potential infection.
All right, I think we got time for one more question from a viewer. Valletta wants to know, where can you get tested if you are concerned you may have the virus? Another great question, do you go to the clinic? Do you go to the hospital? Do you go to urgent care? What would you recommend?
Yes, that's a super question. Again, depending on how you're feeling, if you're short of breath, then that's that can be a serious concern under any variety of circumstances, and seeking care at an emergency department or urgent care would be in order. If you're worried about having the illness and you just want to be tested and don't have severe illness, then calling and getting a triage set of questions done, and then the triage folks can direct you to the right place to get evaluated. But a clinic will be a place, and hopefully over the course of the next couple weeks, more tests will be available to allow more patients to get tested.
All right. Well, doctor, this is all very helpful information. Thanks so much for coming in. And I think we got to end the interview with an elbow bump. What do you say? All right. Thank you for coming in.